Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Heckler.
And I'm Tandi Heckler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome to today's episode of the Rev Up Health Podcast. I'm Tandi, and today we're going to be talking a little bit about our new integrative medical practice called Revelation Health and Wellbeing.
Well, Dr. Mark, so we basically kind of want to tell you what we do. And so we basically had a lot of questions and comments from patients over the years, and we have a lot of situations where folks ask us a lot of different questions and have come in a lot of different symptoms and complaints. So, I mean, basically, have you ever gone to your healthcare provider with symptoms like fatigue or hair loss or weight gain, low libido, hot flashes, or, feeling depressed or anxious or even having decreased exercise performance? And then all you wind up having is labs drawn. And then the doctor just tells you in quotes, so like, everything looks normal, in quotes. And so then you just leave, and then now you're more frustrated that you can't get answers. Or maybe your healthcare provider just throws another pill at you and says, in quotes, it's part of getting older. How many times have you heard that?
So Revelation Health and Wellbeing is a revolutionary way to look at your healthcare. It's more focused on optimizing your health and avoiding disease. Our emphasis is on identifying symptoms and lab trends before they become a problem. We can work at modifying your lifestyle, improving your nutrition, supplements, add in supplements, and, some other medications, maybe optimize your hormones in order to avoid disease and optimize your health. So we're looking for the root cause of symptoms to catch the early stages of disease before they become a problem. Right now, there's a lot of buzz going on about metabolic health and metabolic conditions, and I think that sometimes that gets a little bit confusing for people. So what we're talking about there is maybe an elevated blood pressure or high blood sugar, excess body fat, specifically around the waist, abnormal cholesterol and triglyceride levels. All of these things are part of your metabolic health, and they are absolutely indicators that disease is in the future if you don't fix things.
So we look at the whole person, basically, in a nutshell. There's several different areas of health that come together and complete this picture. One of those being physical health with nutrition, exercise, and sleep. Those things can be watched, monitored. Mental health, which is stress. Who doesn't have that? We also look at the emotional side, the spiritual side. There's also the connection and community, as well as even financial. There's stress in all kinds of daily activities in life.
All of these different areas of health, there's overlap from each different one. And that's why it's so important to really look at the whole person and take into consideration things that might be going on in different areas of life.
So traditional Western medicine is just really focused on disease and treating it, diagnosis and treatment. You got to have a problem, then you'll get treated. They often miss signs that disease is imminent because they're just not looking for it, or they don't run the key labs, or they run the labs, but then you get the word normal, and okay, well, you're normal, so that sounds good, sorry, I can't help you.
I feel like we could do a whole podcast just on how labs come up with their reference ranges for said normal.
Yeah, that would be a good one for later. Or this normal is all based upon, a current state of health for people your age, essentially. So, which is kind of does injustice for people. You may still have disease, but yet, and be in normal range. But do you want to be normal like 80% of people that are metabolically unstable? No. You want to be healthier. It's our goal to help you optimize your health span to meet your lifespan. We want to help you add life to your years, not necessarily years to your life. That might just be a side effect. Along with optimizing your health, we want to optimize your athletic performance and your endurance too.
So as far as the services that we offer, the first step in the process is going to be a discovery call. And this is a complimentary 20-minute phone conversation where you get to let us know what symptoms you're experiencing and what your needs are in a provider. We'll answer your questions, kind of look at where you're at currently and where you want to go, and figure out if we're a good fit for working together.
After that, we'll initiate a new patient assessment. This is a 2-hour comprehensive intake. Now, how many of you have actually sit down with your healthcare provider for 2 hours and went over your labs and what can be done to help you out? And this is something that's just not common practice. I'd say most of you are pretty rare on that situation. So it includes, taking a physical exam, going over the functional assessments. And then, of course, we're going to draw baseline labs and review all that and interpret that and go over that step by step, point by point for you. That's the part that, if you may have normal labs, but okay, they're not normal, and this is where we'd like to see them, and this is the reason why. So that assessment of current lifestyle habits, also including, your sleep, your activity, nutrition, stress management, and even your social connections. That's a very important thing. Social interactions is important for longevity and health and well-being. So we're going to use this information to determine your starting point through further assessments, and then we're going to determine, where you want to be. That's the goal. Your goal is where we want you to go. Where you want to go is something that we're going to help you get there. And so together we're going to formulate this plan and navigate this health journey for you. You're going to come away from this visit, this 2-hour visit's pretty extensive. You're going to come away with a lot of information and kind of a clear understanding of your current state. You're going to know where you're at, and you also know where you're going to go. And it's going to be an outline course for your next steps. They're going to be including these lifestyle changes and what you can implement on your own improvement of your health. If you choose to continue working with us, we would set up an optimization program for you all.
Yeah, I think one thing to note is that the new patient initial assessment could be a standalone service, and that might be all you need. You may take away from that the lifestyle changes and recommendations that we have and just go from there, doing your own thing. And that's awesome. If you do choose to go with the optimization program, where we may do some more medications and monitoring of some other things, it's really important for you to know that this is a collaborative effort. We are here to educate, empower, and give you the tools that you need to be the CEO of your health. This is designed as a health journey to make transformative, sustainable change. So it's not going to happen fast. These things take time and they take work. So if you're not ready to do that, it's okay. It's just not the right timing for you to kind of go down that path.
This optimization program, what does this include? There's basically going to be routine visits built in. Either going to be in person or, be a telehealth. We'll have, prescriptions, supplements, titrated prescriptions for you all to kind of decide, okay, well, what symptoms do we need and where do we need to go? And then how do we need to get feeling better faster?
So also we may use continuous glucose monitors and do evaluation and recommendations based on the data that we gather from that. That is also another thing that would probably make a really good podcast to talk about how beneficial that data can be for you. We talked about supplements. You'll have access to our team to answer questions. And by team, I mean Dr. Mark and myself. But you'll have access to us so that we can answer questions that you might have Those supplements, we do actually have discounted rates available to people who are on the optimization program, education and training via the newsletter, podcasts, and our patient education portal, lifestyle recommendations and coaching around implementation. We're really hoping to have some regular workshops, live and recorded, available. So this is definitely a process. We'll implement interventions and give you recommendations, and you can take those and work with them on a pace that feels comfortable to you.
We'll also have some performance add-on specifications for you guys too. So if there's any specific training or testing that we can offer to improve your performance and maximize your strength and mobility, as well as improve mitochondrial efficiency and function and recovery time, is very important. These are all details maybe for more of the elite athlete or the individuals that wants to get more serious. You want to start running extra marathons. You want to start getting more into extensive CrossFit training and things of that nature. I mean, we want you to excel at your physical activities and reduce your injury and stay healthy so that you can continue to be active and productive well into your 80s and 90s. I mean, you really have to prepare yourself for what's going to happen when you get to be older.
Yeah, I really love, I really love this concept, because the idea that we're training now at middle age for the end game, right? Like, what do I need to do today to be sure that when I'm older, I can still put my suitcase in the overhead bin of the airplane, and I can still carry my groceries into my house and get on the floor and play with my grandkids. All those things that we kind of take for granted, and we're really training for those things right now. And Dr. Mark didn't talk about it, but he is right now doing some extra education to get his physical training certificate. So that's exciting to come as well.
But maintenance support is going to help keep you on track. I mean, we're going to continue to watch for changes that, need to be addressed. This is an ongoing thing. You can't just go into this with one set of labs. Here's what you need to do. See you later. Good luck. Happy life. It doesn't work like that. People are going to get on and fall off the bus, and there's going to be ways of doing this that are going to be better than others based upon your situation and your current health status. To be honest, you may get tired of certain activities, and it's going to be something that is going to be an ongoing treatment. I mean, this type of medicine is fresh. It's exciting. It's new. It's something that is gaining a lot of momentum in the healthcare world at this time. So I think that you're going to hear a lot more from this in the future, and in not too many years from now, it's going to be something that's going to be gaining a lot of momentum. But new interventions are always being available and always being determined.
Just over this past weekend, we went to a conference, and we actually go to a lot of conferences, and it seems like every time we go, we learn so much and get so many new things to bring back to the practice. Another offer that we have is nurse coaching, and I have a board certification in nurse coaching. I did some extensive training and a practicum in nurse coaching, and that is kind of an odd thing that to be called nurse coaching. I think a lot of people are like, what, you coach nurses? And really, no, it's basically, I am a nurse and I am here to coach and kind of help you. And the big part of my program was about transformative coaching. So we can work together one time, or we can do a 12-week program where we're basically checking in every week. Those sessions include a meditation to kind of get grounded and get started, and really kind of digging into, what do you need? And I can also serve as an accountability partner for you in that. I mean, that's all part of of all the service that we have to offer. But in a nurse coaching program, a 12-week program, that's a little more in-depth.
And then my certified personal training certificate course that I'm taking too is purely for me to gain more knowledge on, what it takes to be productive, efficient, and, really perform your best, in a safe manner and yet get results. It's important as we get older to maintain muscle mobility. That's going to keep you safe. You're going to get older, you're going to stumble, the ground's going to be uneven and you're going to fall, and it's going to be something that you're able to either catch yourself or to prevent yourself from being hurt. So it's important to pass that knowledge along also. I mean, our practice is basically going to be built around certain core values. One, it's going to be patient-centered. Number two, it's going to be adventurous. We are adventurous folks ourselves. Tandi and I do a lot of traveling, and we like to do a lot of hiking and running and biking. So it's something that we enjoy. And then it's going to be more of a growth mindset, and everyone's going to be included. So we it's not just for certain people, it's for everybody. And, kindness is going to be something that's also there. We're here to help you. We're here to be with you. And I think that once we get to work together, I think it's going to be something that you're going to enjoy and want to continue, because once you start feeling good, you're going to want to stay with it because you don't want to feel the way you used to.
So I have just a little bit more time to tell a little bit of how we came up with Revelation Health and Wellbeing. And many years ago, almost feels like another lifetime, I used to live in a community called New Longview. It's in Lee Summit, and it is based around the old Long Farm. And there are old barns there at the farm. And if you're from the area, you know them well. Anyway, I had a dream that I would renovate those barns and turn them into like a fitness and wellness institute. And Lulu Long Combs had many horses, but one of her horses was called Revelation. And so I always had this dream that I would take those barns and I would create Revelation Health and Wellness. And so when we started talking about this new practice and what it would be, that really came back to me. And what's really fun is that our new clinic is going to be in an old barn that we restored. I mean, not really restored, but we renovated it to make it more of a fitness clinic space. So kind of fun that little dream came full circle. So if you're interested in hearing more, or if you want to work with us, you can find out more information at revelationhealthandwellbeing.com. There is a contact us page where you can put your information in and we will reach out and contact you, or you can sign up for our newsletter. We really appreciate you joining us, and we hope you have a fantastic day. Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.